After the full-scale invasion, there was a short moment of confusion when various people in non-governmental sectors were sort of thinking out how to help people and what to do in order to respond to the crisis, and essentially we started doing what we could. We had a fleet of commercial vans that were procured for HIV work essentially, and we started using those vans to transport humanitarian aid from abroad to the country and also between different districts of the country, and essentially trying to adjust our program so some of the funding could go towards humanitarian needs of our clients and beneficiaries, and that was before we met with the Christian aid, when the kind of more strategically structured program was designed and we started systematically engaging in humanitarian work, and now we implement several important directions and we are doing better and better with this. I will probably select a couple of directions of work to tell you about, and the first one, and probably the most well, the dearest maybe, is the supporting community initiatives on the ground. So essentially, it appears that people know what to do in times of crisis, but they need resources for this. So our task is just to facilitate this work, to provide the support that people require, and give some modest funding to resolve different challenges. And this is a very flexible instrument. Essentially, we can support anything with this. So it can go towards food, hygiene items, it can go towards medicines, but it can go into simple things like restoring a well in a village, for example, or repairing transformation power station. Also the money went to improve conditions in temporary accommodation facilities and shelters, towards improving conditions of life in large families with multiple children, adopted children, and also in special facilities for people with disabilities, including children with disabilities. We, for example, procured special sensory equipment for children with visual impairments, and there are multiple examples. You can do anything with this modest funding. Essentially, the average size of the grant is about £4,000, but people implemented amazing things with this. Probably emotionally, some of the most striking examples relate to our mobile support units. We actually sent teams of people to recently deoccupied areas or areas very close to the front line. It's a very challenging work because the territory is completely destroyed, there are no roads, and it's also heavily mined. The amount of mines in Ukraine is incredible. It's estimated that about 1/3 of the country is now contaminated with mines and other explosives, which is, I think, about 70,000 square miles. So essentially, we sent teams of a doctor, psychologist, social worker, and a driver, and they normally bring 2 or 3 vans, and one van carries humanitarian aid, foods, clothes, medicines that we distribute. Another van is the service delivery unit where the doctor and psychologist sit, and another one is a diagnostic unit. And we have some basic diagnostic equipment for cardiological examination, for testing for infections. We have a mobile X-ray and some other equipment as well. So for some of the people we've met there, it's been the first time they've seen not only a doctor since the beginning of the war, but any kind of agency that offers at least something. So for us, it's distribution of the stuff people need, but for people, it's a significant event. It's a really important event in their lives when they actually get attention, get some compassion, and well, just can speak to someone for moral support and for something else they may need. in most of the bomb shelters that we had before the war were not ready to accept people, and many of them were closed, many of them were repurposed for some commercial facilities, etc., etc. So it took quite a lot of time to prepare at least some of the bomb shelters to be able to accept people, and obviously it's hugely affecting the emotional state of people. And I mean, I'm not mentioning casualties and loss of relatives and friends and all these things. If it comes to just different examples, one may relate to people who lost their limbs, and people that are now disabled because of the war. And there are 20,000 people currently queuing to get prostheses, and these are those who managed to officially register for this, and it's quite a lot of paperwork. So there are many more people that are not part of this figure, and this include both military and civilians as well. Yeah, it's very difficult. I mean, it's becoming more and more difficult to make predictions and estimate the number of time the war will continue for. And we always framed our response to the war as responding to the war and post-war recovery. And now we see that recovery is already ongoing, because we are addressing the damage that's already been caused, but the war continues, and the recovery will continue for at least several years after the war. Just one illustration to give is one of the analytical tanks estimated the number of years it would require to fully demine Ukraine, and they came up with 757 years as a figure, which in practice means Ukraine may not be fully demined, never. So, I mean, this gives you an idea of for how long the support may be required. Well, the first thing, we are enormously grateful, and we are very privileged, very happy to be in this partnership. It's very important to feel the support of other organizations and people in multiple countries, to feel the supporters. We do not see supporters, but we feel the energy that these people give, and it helps us enormously. It motivates us to work, and it makes us proud, and it's a joint pride, and we thank you for this. The message to supporters is, please don't give up, because we need the support, and we are very grateful for the support. We will require it for a long time. I guess we do understand the challenges and kind of conflicting needs around the world in multiple countries, crisis, and I appreciate the need to prioritize and sort of decide where to channel the funding, where they are needed the most. But this prioritization, it's a very complex puzzle that we are trying to put together, and I think together again we will put it together, and we will achieve what people need and provide the support that they require.